CENTER Maine is partnering with the Maine-Monitor to bring you some of the reporting being done by journalists at the nonprofit independent publication, and we'll be featuring one of their stories each Monday. So today we are talking about childhood vaccinations in our state. Students entering kindergarten in Maine must be vaccinated against polio, measles, whooping cough, and chickenpox. However, there's been more and more pushback against mandatory vaccinations from some politicians and parents. Rose Lundy is the senior public health reporter for the Maine-Monitor. She's been digging into a decade's worth now of childhood vaccine data to see how rates here in Maine have changed over time and where there are the highest exemptions to some of these. So first of all, thanks for being here. This is a big topic to discuss for a lot of families.
Thank you for having me.
We want to jump right in light of the national conversation now around vaccinations. How have we seen childhood vaccination rates in Maine change over the last few years?
Yeah, absolutely. So in light of the recent confirmation of Robert F. Kennedy Jr. as health secretary at the national level, I was interested to look at how Maine's vaccine rates have changed over the last decade. So I went back and looked at some data from the Maine Center for Disease Control and Prevention and saw that last year Maine's rates of vaccination for kindergartners was actually at about 97% for all 4 vaccines, and saw that vaccination rates have actually increased in the years since lawmakers passed legislation in 2019 removing the non-medical exemptions for these vaccines. So we've seen an increase. Prior to that law, we actually had among the highest opt-out rates for vaccines in the country. But last year that rate was at 1% and the national rate was about 3%. So we've seen an increase. However, some of the public health advocates I talked to are worried about vaccine hesitancy increasing going forward.
And I think we're seeing more of that conversation nationally as well, which will certainly factor into that. You mentioned the 2019 law. How has that non-exemption part impacted our schools and having that option out there?
Yeah, absolutely. So I looked at the schools that had the highest exemption rates last year and found that there were 19 schools that had exemption rates of 5% or more. So that's for, you can still get a medical exemption. So those schools had higher rates of medical exemption. It's worth noting some of those schools had pretty small class sizes. So we're talking about a couple of students for some of them, but some of them had bigger class sizes. And I talked to some of them about why they have these higher rates, and they said that a lot of them could be temporary exemptions. You know, someone might be coming from homeschooling where they're not required to have vaccines and they need to get caught up. And they said this law from 2019 actually makes those conversations easier because it's really cut and dry. They just say, this is the law, this is what is required, and if you don't want to do it, you have to talk to your doctor to get a medical exemption. So
there's still that avenue to have a conversation with a medical professional.
Absolutely.
But the black and white part probably helps on a lot of fronts there. Curious, you know, as you've been looking through data, what county had the highest rate per se for the exemptions, and really what are we hearing from medical experts about kind of the current dialogue around vaccines?
Yeah, absolutely. So the last year, the county with the highest rate of exemption was Piscataquis County with 3.7%. And I spoke to someone there who's a longtime public health advocate and has done a lot of work with childhood vaccines. And she said she expected that number to be actually higher because the county has historically had lower rates of vaccination. And one reason could be lack of access to health care. Families might have to drive a long distance to find a pediatrician where they can get their vaccines. But she also said that in recent years she's seen an increase in anti-vaccination attitudes and also a lot of misinformation. So she does worry about that growing going forward. 2
big factors there. You know, we've certainly been talking about access to medical facilities for families and the rural parts of our state. So that's an important part of the data you've been looking at. Just a snippet here, of course, but Rose, thank you for joining us for this conversation. Of course, you can read the full story and much more online right now at the-maine-monitor.org.